Hi, this is Dr. Roger Clifford, your Dallas chiropractor from Clifford Pain Relief Chiropractic. Today what I want to video is basically just a regular returning patient visit, and I also wanted to especially describe and show the adjustment, the chiropractic adjustment I will be doing. I almost feel compelled to do this because nowadays so many patients are going on YouTube and looking at a lot of different other chiropractors doing adjustments online, and I just think that a lot of times they are quite different than mine. So for my patients and for future patients to really understand what to expect on a typical visit and with my chiropractic adjustment, my treatment, to really know for you to kind of know what to expect, and hopefully it'll even possibly ease any potential fears that you might have, that you'll see that hopefully, oh, you know, that can feel good, it's pretty gentle and easy, and I think that it can help. So now maybe we can bring in our patient. Hi, Tasha.
Hi.
It's nice to see you.
Nice to see you.
Thank you. As you can tell, we're videoing you today. Thank you for giving us consent for doing that.
Absolutely.
And so as I mentioned, this is just going to be a typical visit. I'll ask you how you're doing. We'll just do a few different little mini exams. This is not like the first visit where we did a lot of more of an intense, detailed physical examination.
Okay,
Does that
sounds
make
good.
sense?
Makes
Sounds
sense.
good.
Great.
How are you feeling today?
I'm feeling pretty good. A little pain here, a little lower back pain. Other than that, pretty well.
Okay, and how does it feel compared to last time? Do you feel better, worse, or about
I
the
do
same?
feel a lot of relief. It's feeling much better.
All right, that is great. Well, please keep on standing there and put your hands just like this. And now go down sideways to your right. And now go sideways down to the left. Just checking range of motion here, and that actually looks pretty good. And now go backward like that. This is basically lumbar extension. That looks pretty good too. Now bend all the way forward into lumbar flexion. That looks really good too. Very good range of motion. That's definitely much better.
Okay.
Does any of that hurt when you're doing that?
Nope, no pain.
Okay, great. So please come right over here onto my adjustment table and lay face down on your stomach here. Now I'm just going to go through just a little pre-chiropractic adjustment palpation, where I just basically use my hands to feel what is going on and feel for areas of the back that might be pretty tight or restricted or even misaligned. So I'll definitely see, by using this pre-adjustment mini exam, I'll be able to tell hopefully where I should be making the adjustments.
Okay, sounds great.
When I'm pressing here, how does that feel?
Feels fine. There's no pain.
That's good. That's a good sign. And how about up in here?
A little pain there, just a little tension.
Okay. And how about up in here?
Pretty sore. Lots of tension up there as well.
Yeah. So what I am feeling, just so you know how anybody who's looking at this video will be able to tell, is when I'm feeling down low in the lower back and into the pelvis, that feels pretty good. It feels pretty loose, and the muscles feel loose. I don't feel any spasms or tightness or inflammation around the spinal joints in this area. And however, when I get into the upper lumbar or upper part of the lower back, and then also into the lower part of the mid back, that's where I'm starting to feel the tightness and restrictions to the spinal vertebra, to the joints in the back, basically from here to here, a pretty big area there. But it also does feel better than it had been previously, so that is really good. And how does it feel up in here?
Tension as well. Carry a lot of that in my shoulders usually.
Oh, okay. And that's a pretty common finding I see, especially in this day and age of most people working in an office setting or on a computer a lot, on cell phones, smartphones a lot. And when I'm pressing down in this area, I can feel the tightness of the vertebra, so I can definitely tell what you're talking about the about how you feel tight between your shoulder blades. And so basically what I'll be doing is I'll start adjusting mostly your middle back while you're in this position, and then right after that I'll have you lay on your sides in order to adjust your lower back.
Great.
And where I'm going to be making the adjustments are exactly the areas, the regions where I found the problems just a minute ago, right before I am doing these adjustments. So please breathe in, and now breathe out. Ah, perfect. Did that feel good?
It did. It felt great.
Great. And this is not me bragging, but I really just try to make every single adjustment feel as good as possible, as if I was the patient getting the adjustment. How would I want to have the adjustment feel? And that's what I really try to do. So adjustments are done pretty quickly because it beats the body's response, but that's how adjustments can also actually feel good while you are getting it done. I'm gonna do another little adjustment right here. Breathe in, now breathe out. Great. Now that I can tell as I'm feeling this part of the back after the adjustment, it feels better, it feels looser. Did that feel okay to you?
Yes, it felt great.
That is great.
Lots of tension relief.
That is great. And now I'll have you lay on your right side facing me, and I will focus on your lower back. So relax your head right over there.
Okay.
Let me get this hand hold here, and this hand hold here. And now I'm gonna bring this leg forward and this leg backward. And as you all can possibly tell, if you've seen other videos before, every chiropractor does things just a little bit differently, but this is the way I like to do the adjustments here, and I think that it works very well for my patients. I'm just gonna have you relax your shoulders a little bit, bring that backward, and I try to do these lower back adjustments with as minimal torsional force as possible, so they're done as gently as possible while still making progress. I'm just gonna bring this forward a little bit. There it goes. Good, perfect. That feel good?
It did.
Great. Now lay on your other side. And if you've never had this done before, you may think that, well, maybe that does not feel so good. But actually, I think Tasha would say, and I think just about all my patients say, I don't want to brag like what I said before, but typically these adjustments feel, I think, pretty good. Let me get this leg forward and this leg backward, just like that. Just relax as much as possible. I'm gonna bring your shoulder back a little bit more. I'm just gonna bring this part, and as you can tell, I'm using my fingers and also my forearm at the same time in order to make this adjustment. Great, perfect. And now lay on your back facing up. Now I'm just gonna, I know you didn't mention anything about your neck, but I'll just feel your neck and to see if possibly it needs any adjustments there.
Sounds great.
Has your neck been feeling okay, or have you had any problems
between my
there?
schoolwork and looking at the computer a lot, I have noticed a lot more tension from looking down, writing notes and such. So a little bit more tension than I usually have.
I see. So I'm just going to basically do what we call motion palpation. I'll be using my fingers, and I'll be using my fingers to basically move each individual vertebra segment, or each neck bone vertebra, and see how it's going. And I can feel some tightness right there. So, and as Tasha indicated, it's uncomfortable there, and very often times where I find the restrictions are also where the person is actually feeling any kind of pain or discomfort. Because the goal, of course, is to help people get neck and back pain relief as quickly as possible. And on his left side, it feels a little bit different. Here it feels okay, but I can feel the increased stress and tension down low in the lower neck, or lower cervical spine. So that's where I will make my adjustment. Just relax your head down here as much as you can. Perfect. And as you can tell, the adjustments are done quickly, but over a very, very tiny area, basically just a millimeter or two. And so that's basically called low amplitude. But by doing that, it can feel actually pretty good while you're getting this treatment done. And also, what's most important is it gives a lot of people a lot of relief. And right here, this is your C3 vertebra on the right-hand side of your neck. Great. And I always like to, especially for neck adjustments, do at least a little brief massage right after the adjustment to relax any residual muscle tension or tightness. Sometimes I also do a little bit of manual traction like that. Most patients like that, and a lot of people, if I don't do that, even ask for that, ask for this sort of little traction treatment right after their neck adjustment. And I always like to check before the adjustment to see what needs to be done, but also I like to check after the adjustment to double check and see if we've made a difference, if we've made improvement. And so now when I'm feeling down low here on the lower left-hand side, this feels much better. It's much more relaxed and loose. It's basically increased motion. and also it's much better on this upper right-hand side, on this right side of the neck. So that feels better too. All right, so if you want to get up now, you can.
Thank you.
My pleasure.
Oh, I feel a lot better.
That is
feel
great.
much better.
That's great. That's great to see you again today.
Good to see you too. I'll see you next time.
That sounds great. And as we mentioned before, this is just a typical visit, and I'm so glad that Tasha is feeling better, and hopefully sometime soon you will feel better too. And as I mentioned, this is Dr. Roger Clifford at Clifford Pain Relief Chiropractic.